Hello. Yes, I am with a patient right now, but do you mind me calling you back as soon as I get done? Alright, perfect, thank you. I'm so sorry, it's actually pretty hectic here today. I am Isis the Enchantress, and you're doing the last part of your exam, right? This is just the adult new patient questionnaire. So what I'm actually gonna do is just ask you a few questions. But first, I need to start by okay. I need to just record today's date and just some simple things about me first. So do you mind just giving me 1 second? So did you have a pretty good experience here? Mm-hmm. Well, that's pretty great to hear. We do strive to give the best service that we can, which is why I'm actually going to try to get this done as quickly as possible. So the first thing that I need to know right now is your age. Okay. Yeah, by taking your age first, it actually lets us know which one to give you. So do you mind providing me with your name? Okay, that's a pretty sweet name. May I please have your actual date of birth? Alright, thank you. And what is your primary language? Okay. And do you have any special needs in any of the following areas? Reading. Okay. What about vision? Do you have any trouble seeing with your eyes? Okay. So I'll just add that you wear glasses. What about hearing? Can you hear pretty good? Okay. And mobility, like do you have to use a wheelchair or a walker, a cane, etc.? Not yet. Okay. What communication? Alright, do you ever find yourself needing a translator? Okay. Well, we have the first part done already. The next part we're gonna start is the home part. So I'm just gonna ask you some very personal questions about your home situation. Like, are you single? Do you have a long-term partner? Are you married in a civil union, divorced, separated, or widowed? Okay. So does that mean you have any children? And if you do you mind providing me with their ages? Okay. Okay, and do you mind listing, just out of all of them, listing any current members of your household? Alright, it sounds like you have a pretty full house, so I just wouldn't know. As far as your employment, are you working full-time, part-time? Are you an at-home or homemaker, looking, disabled, retired, or are you a student in school? Yeah, I figured you worked full-time. On your current occupation? Thank you. Do you have any medical allergies? Okay, well, it's good to hear that you're perfect. We're expecting other patients today. I'm just trying to look out for them. Are you on any current medications? Okay. What about medical conditions like allergies, anemia, anxiety, arthritis, asthma, blood transfusion, cancer, clotting disorder, congestive heart failure, depression, diabetes? Okay. Now the next group, glaucoma, HIV, high cholesterol, hypertension or high blood pressure, kidney disease, nerve or muscle disease, osteoporosis, seizures, sickle cell anemia, substance abuse, thyroid disease, or tuberculosis. Okay, now we're just going to move on to your surgical history. Have you had any surgery at any part of your life? And family history, has your mother, father, sister, brother, daughter, son, or any other relative had any alcohol abuse? Breast cancer? Okay, who had breast cancer? Thank you. Ovarian cancer? Prostate cancer? Any other cancers? Okay, what kind? Thank you. Okay, what about diabetes, heart disease, high cholesterol, hypertension, or mental illness? I'm sorry. All right, thank you. And as far as your habits and activities, do you use tobacco? Okay, and how much? If you just had to make a guess. Okay. Have you tried to quit? Would you like to quit? Thank you. What about alcohol? Do you drink alcohol? Only sometimes. Okay. And how many drinks per week could you say? Alright, thank you. Have you ever used any recreational drugs? Yes. Okay, and what kind? Don't worry, we won't tell. And do you get regular exercise? And what kind of exercise is that? Okay. What about immunizations? Have you gotten any shots for pneumonia, your booster shot, your TB skin test, hepatitis B, hepatitis A, chickenpox, and shingles. Okay. And your preventative care, have you had a colonoscopy, bone density test, cholesterol test, prostate cancer test? Okay, pap smear. What about an HIV test? Okay, that's good. That's perfect. Your sexual history. Have your sexual partners been male, female, both, or are you never? Of course, you've been sexually active. You have children, but okay, that's no problem. Have you had more than one sexual partner in the past year? Have you ever had a sexually transmitted disease? Okay. How many times have you been pregnant? And do you normally use contraceptives? Okay. Do you feel unsafe or have you been harmed in a physical, emotional, or sexual manner in any relationship or recent encounter? Okay, good. Thank you. And in the past year, have you had 2 weeks or more during which you felt sad, blue, depressed, or when you lost all interest due to pleasure and things that you usually care about and enjoyed? Alright. So in the past year, have you had any major life changes or stress that you feel may have impacted your overall health? Okay, could you describe those? Alright, and do you have any additional comments or concerns? No? Alright, so what I'm going to do is go ahead and send this straight to the front desk. And thank you so much for taking the time to do this survey. Like I said, some patients just straight leave and don't even do the questionnaire, but it actually gets you better services because we need your feedback to assist us with making this better, especially for patient care. So I hope to see you next time. If we update this, then I will go ahead and send the updated survey and you won't even have to come in since you came in the first time. Okay, so I'll see you next time. Bye bye.